So we are in the middle of something called flu season. I'm sure you all are very aware of what that is. But it is a really terrible flu season. Here are some thoughts, if you don't mind me sharing, okay? If you have a team member from your softball team who is sick or injured, you do not bring the entire softball team in to check on them. Because guess what? You just got maybe 15 new vectors or carriers of the flu by them all walking in, which I watched them each walk in last night, see their friend, and not touch the hand sanitizer not once. So, please don't bring your team in. Please don't bring your healthy children, especially your newborn babies, into the emergency room. And if you don't have what I call a true emergency, this would not be the time to come to the emergency room. So, right now we have up to 25 to 30 patients sitting for hours in the emergency room waiting room. Some of them are not true emergencies, but they're waiting along with the flu right next to them. So guess what? 5 flus came in, 15 flus walk out. It's great. And guess what? Half of them don't realize they have the flu yet. They'll be back. Here are some ideas to how to treat the flu at home. Wash your stinking hands so you don't get all your baby sick. Hydrate yourself. Get the fever down. Wash your stinking hands. And cover your nose. Watch this. I'm going to teach y'all a magic trick. It's amazing. Achoo! Let me repeat it in slow motion. Achoo! It's amazing to watch how many people come through the emergency room, sneeze in their hand, and I watch. No one grabs the hand sanitizer that's only every 3 feet in the ER. Most nurses in the emergency room also are only getting 5 seconds to eat. 12-hour shifts, mind you, on our feet. My toes are swollen, but on our feet, getting yelled at. And I want you to know, I get yelled at and cussed at. I'm a good, friendly person. I get cussed at, y'all. Okay? But I've been getting cussed at recently because people are so mad about their weight. Well, there's 1 to 2 doctors at night. No, there's 1 doctor, excuse me. Let me rewind that. 1 doctor, and there's 20 patients in the waiting room, 16 patients in the back, somebody coming in on an ambulance, and we do this based on triage. If you've been waiting for 4 hours and you're just ready to get out of here, but all of a sudden there's somebody coming in who's bleeding to death, or they're not breathing, you're going to have to wait a little longer, okay? If you're here with an ingrown toenail, or I just got these headaches, you're not going to die. We check you out when you come in the door, okay? We can tell based on an eyeball assessment, you ain't dying currently. You're going to have to wait a little bit longer. I have a lot of stress. Please thank an ER nurse and every nurse and doctor that's taking care of sick people right now. We're putting ourselves into the thick of some nasty germs to help. We don't get lunch breaks. We're exhausted. We're getting yelled at, but we're still coming in and doing it every time.